So if you would, go ahead and get in positions. If you have not placed your name and campus in the chat, please do so. All right, again, good evening to everyone. Hopefully everyone is doing well and welcome to week 2. Make sure that you place your name and campus in the chat. Just keep in mind of what the rule book, the conduct book says about your places that you're supposed to be and the places that you cannot be. We do not want to violate HIPAA. And of course, we want you to be safe. So just keep that in mind. As always, these sessions are recorded and they are viewed by the attendance administrators. Check your name on the screen. Ensure that your first name and your last name appears how it appears on the roster. Make sure you go in and change that. If not, and in order to change that on my side, if you go to the right of your square, there are 3 little dots, click it, and then a menu will pop out. One of the selections is rename. So, and that's how you can change your name. All right, let's see. Hopefully everything is going well for you. Let's see where we're at. I know there are some, if you received an email from your campus about attending that HESI training, make sure you're where you're supposed to be. Not all campuses are included in that. So if you did not receive an email, you're supposed to be in class with us. If you receive the email about HESI or NCLEX coaching or something to that effect from your, hopefully you have logged into your Outlook mail. You would have probably more than likely gotten it through your Outlook mail. Remember, we talked about making sure that you had access to your Outlook mail, your Canvas mail, and then Campus View. They may have even sent the announcement via Campus View, but there are only certain campuses that is involved. So if you did not receive an email, then you're supposed to be here. But if you did receive an email, you need to be where that email is directing you to be at, which is not in this class tonight. All right, so let's go ahead and look and see where we're at and where we are headed. And get our course shell pulled up here. Okay, so we are in, share my screen here. Yes, I think the campuses that are here, you're supposed to be here. Yes, because I forget the name of the campuses, but those of you that are here, you're supposed to be. And that's one of those things I mentioned last week too, that, you know, some things are campus specific. So make sure that you're doing what, is required of you and on your campus. So if you hear a classmate saying something that you don't know about, check in with your campus dean because it may or may not apply to you. Okay, so last week you had your required readings. We talked about how nursing has evolved, that critical thinking process in the nursing. We can't get away from the nursing process. And then more specifically, our role in that process as a LP. What is our role? And clinical judgment as well. Can't get away from that. We're lifelong learners as PEN. So just know that that is something that we will just continue to develop and, as we continue our journey in this health profession. So we'll look at the group project and the topics here in just a moment. So for week 2, this would conclude all of our content that is for exam 1. And we do know exam 1 does not occur in week 3 like it's listed. It will occur in week 4. But nevertheless, all the content for exam 1 is the topics from week 1 and week 2. So this week we'll finish up. We kind of talked about it a little bit last week on ethics, nursing law, what is that healthcare law? Why do certain things happen or why do certain things not happen? Because what does the rule say? Then we'll go back to that. So we'll look at that in more in depth. But again, exam 1 is in week 4. It is not listed. It will not be on next Monday because remember, all campuses are closed on next Monday. So when you come in for week 4, so we don't even log in. So don't even log in on next week. But when you come back on week 4, we will take unit exam 1, which includes content from week 1 and 2 only. 1 and 2 only. And then we'll move forward with we'll get back on schedule on next week. Okay. So let's look over here at our group project. And of course, we'll give you time at the end also to look at that. There were just a few changes with some of the groups. We did have some students to move around in different sections. I want to say there are 4 or 5 sections of this class. So there were just some minor changes. But let's look at the actual rubric. So you'll be given time to talk more about specifics this week. Okay, so everyone has a group. We'll check it just to make sure we didn't leave anyone off. Okay, we have your topics already assigned, and we'll open up the Word document as well. So as a team, you'll research the topic, connected to PN practice. And then it's been suggested, you all asked last week about the poster. It's been suggested that you all use a PowerPoint. So however many slides that you all come up with, but it's been less challenging is what most are reporting, to use a PowerPoint rather than that, that virtual poster. Okay, so you place all of your information on PowerPoint. There is not a slide count, just whatever information so that you're answering the questions that are in the rubric down here. We'll look at that in just a moment. So it is a PowerPoint. There is not a slide count, but just so that you answer all of the information that's here under the topic that you have. If it takes 2 slides, 3 slides, however many slides, just to make sure that you answer everything. Okay. So in week 10, this is not due until week 10, but it's going to take time prior to week 10, to get everything together. You all going to have many conversations, virtually, digitally, electronically, and face-to-face during class to kind of talk about it and work out, decide what the plan is and how to move forward with that. So as a team, you have your topic. And then you want to connect it to PN practice. So as you look through and sift through information that's out there, remember we want to use the last 5 years, include at least 3 scholarly sources that are, no more than 5 years old. So you will find information out there about, referencing physical therapy, the registered nurse, but we want to connect it to the PN practice. So make sure that you fine tune your search. We do want your PowerPoint, gotta stop saying poster, PowerPoint, to be visually engaging. So think about, what pictures or what information can engage us and help us to better understand the information that you're trying to give us. Okay. So then the group project, you'll present your PowerPoint in week 10. Everyone will take their turn doing the presentation. You'll talk to us. And then you'll be timed. Want to make sure we see this part right here. 5 to 8 minutes. So each group, a minimum of 5, no more than 8. And then once you put the project together, everyone turns in the same project, you all. So if there's 6 of you in a group, 5, 3 to 3 persons, everyone click and turn in the exact same project, which is a compilation of all the PowerPoint slides put together. No, I know you probably had, I don't know if you all have had community where we actually had a group project and each person turned in, what they did. But everyone's gonna turn the exact same thing. So if we're working in group one and we end up with 10 slides, all of us turn those same 10 slides. Okay. So the PowerPoint should have a clear explanation of what your topic is, the summary of evidence-based information on the topic, include three scholarly sources that are no more than 5 years old, and then reference it, make the information current to the PN practice. So it is a PowerPoint. Okay. All team members must contribute meaningfully. You'll be given time, like I say, during class, and then you cannot complete this during class. Make sure we're clear on that. You will not have enough time to complete this on during class time, but we'll be able to check in and have those conversations during class time. So it's going to be required of you to, decide how you're going to communicate. I know there's all different methods out there, apps and WhatsApps, and we don't recommend either or, but just whatever you all decided to. Okay, and then on week 10, each member must speak during the presentation. Okay, we want
Excuse
to.
me.
Yes,
Those two of classmates that was assigned to our group, they're not in this class anymore. You say you're gonna reassign?
it has been reassigned.
Okay.
Yeah, yeah. So initially, that's what I said. There's a few changes, so you might not be in the same group that you were in last week because we had to give that time to work out whatever those issues were with campuses and scheduling. So we'll look back at it's a posting. It should not include those students. Should not include those. Thank you for
Okay.
bringing that to my attention. We think they've already made all the changes. They should have been resolved by now. So it should be everyone that's here. But we'll check that at the end. So each group has a topic, and then you want to develop, for example, the PN and the nursing process more than tasks. So your PowerPoint should include information about, what a task focused day looks like. In the past, and I don't want to cramp your creativity. Students have videoed or gotten, someone they've interviewed a nurse and they've gotten their information, hey, in the day of, and they kind of just gave like the highlights. But just however you want to just make sure that you go through and that you're answering all the points that's under addressing all the topics and the concepts that are here under your topic. So if group one, they only look at this part right here, the PN and the nursing process more than tasks. Compare what a task focused day looks like versus a day where the PN uses clinical judgment and critical thinking. What is clinical judgment? What is critical thinking? What does a day look like? Is a day 3 hours, 8 hours? And then you can change it. You can compare it to settings. Home health. You all have at this point have rotated through different settings. Not trying to tell you what to do, just trying to help you to just think it through. There's more than enough information out there. Really, you could talk about each one of these more than 8 minutes. So you're going to have to really think about how you're going to condense it down and still give us, a good understanding of the topic because it can get really, really lengthy. You do want to highlight the practical nurses. How can they go beyond routine tasks by thinking through patients' needs, priorities, and safe care planning? So all of those, just a whole bunch of pieces. What is safe care planning? What about this? What does this patient need? For example, this patient is newly diagnosed diabetic, heart failure. They're in rehab. This patient has had a hip fracture and they've had surgery and they're post-op 21-day rehab. Now they're back at home. So, but just think it through. Like I said, you're going to probably more than likely struggle with narrowing it down so you don't go over your 8 minutes. So that group, that's all that they're going to talk about. Group one does not have to look at anything from group 2, 3, 4, 5. So that's their whole focus. All right. And then the rubric is actually let's go here. It's actually listed in week 10, even though we're talking about it now in week 2. So go all the way down and it's going to be here. So to find out more information, to look at that rubric closer, just go here in week 10. Like I said, you always want to just grade your own project. Look and see what What would you give it? Well, does my PowerPoint does it after looking at this PowerPoint and after the person's listen, are they going to understand the information that we presented here? Is it as clear? Is it concise? Or what we're giving them, or is it inaccurate? Do we need to go? And if it's inaccurate, the group needs to go back and rework it because you don't want to turn in anything that's not going to be as perfect, close to perfect as you can get it because you want all your points. All right. So we'll look more closely at the groups just to make sure that the groups do reflect all the changes because there were changes with people, classes and sections and everything. So we'll look at that toward the end. And just as a reminder, if you receive a communication from your campus telling you needed to be somewhere else tonight besides this class, hopefully that's not any of you all. Okay. You have gotten the email via your Outlook mail. Okay. All right. So I don't have any questions in the chat. So let's move forward with our content here. Just waiting on our PowerPoint to open up here. We got to go through the first couple of slides together, and then we're going to, of course, we always utilize the chat. We always ask you to come off mute, and then we'll do the small group and the large group. So just to know, let you know how our format will be. So let's get started here. We're talking about ethics. What is ethics? What in the world is that? So in the chat, just put a one-liner if you need two lines. What do you think ethics is? What is that all about? What is ethics? Let me set my little timer here, give you 75 seconds. You were just explaining to your patient or your team, because you can be the team leader, the topic was going to be ethics. What would you tell them ethics was, is, or what's your understanding of it? Go to a little timer here. Okay. So the task at hand is you're the leader and you're on the agenda to discuss ethics. And you're just going to give them just a small blurb in the chat of what ethics is. Oh, yes, and then send it out to everyone because even though more than likely we're going to all say the same thing, it's going to be said a little bit different. The more times we see things, even though we're not trying to remember it, we just put it pops in our memory bank. So send your responses out to everyone. So far, pretty good. Right or wrong in decision making, fairness, how someone or group of people will behave themselves, basically moral principles. Few more seconds. What's right and what's fair, decision making. Yep, yes, it does affect our decision making. Yeah. Okay. Using ethical and moral grounds in decision making, a branch of philosophy that explores principles, morals, right and wrong, and good or bad. So, is there ever a time, and you can just come off mute and answer this, do you think there's ever a time where our professional ethics and our personal ethics might not agree?
Absolutely.
Yes. Yes.
Okay. Give me an example. What would be an example of that? Professional ethics and personal ethics, they might not agree. Give me an example.
Probably like say um you're working with
Religion.
say you're working with kids and you see a parent not discipline you see a parent disciplining your patient a way you would not discipline your kids.
Okay. Someone else. There was someone else trying to give us an example. Was it you, Miss Fuller?
Oh, sorry, I didn't know.
Yes, I would say
You went back on mute.
I would say it probably someone with different with a different religion or different beliefs.
Okay. So remember the Nurse State Practice Act. These are the things that we can lawfully do. We can go, we can work in this setting, that setting. And remember the facilities policies and procedures, they should mirror, it should be pretty much exact as what our standards of care, what our standards are. The only thing is, depends on the setting, it might be a little bit different. Like the temperature might be only taken orally at the urgent care or at the long-term care facility. But our standards tell us exactly what we should do. We can lawfully do. But we might work in an urgent care center or the ER or the long-term care center, and they are performing procedures that we can lawfully do, but personally, you might not want to discipline your child. For example, that she gave, you might not want to discipline your child like that. Or that procedure, you just might not want to be a part in. But lawfully, you can participate with that procedure because that's what we have a license in whatever state. And our nurse practice act says, hey, Nurse Harry, Nurse Middleton, we can do these things lawfully, but we might not want to do them because, personally, that's a procedure or something that we might not want to take part in. So, but what should we do in the event that that happens? Just refuse to do the procedure or participate in it? What should probably happen?
Respect their wishes.
So more than likely, the manager is going to do that, respect your wishes, but what should happen? How's the manager even going to know that there's a conflict with your personal and your professional ethics?
You have to let them know during like interviews.
Yes, have a discussion, communication, talk about it. That might be the setting that you want to work in, but there might be just this one thing or two things that lawfully we can do them because we have a license in that state. Our nurse practice act says that we can do them, but personally, I don't want to complete those tasks. So just have that discussion. Discuss what your concerns are with your manager, and see where if there are any alternative responsibilities or job tasks. Whatever the procedure is or whatever it is, the task is on if it's your turn on Mondays, maybe you and I switch up with the task on Mondays. I complete the task that but beforehand you discuss this with your manager, and the managers had, come to the other team member and say, hey, Nurse Clara, Sierra doesn't want to do this procedure, and they might even go into they don't have to go into the details, but I want you to switch out. So do you mind doing this, Monday and Tuesday rather than just Monday? So yeah, it's just a discussion. And sometimes they might not agree, and it's okay. But don't assume that the manager knows about it. You'll have that conversation. You can do it in the interview. And a lot of times, hopefully, during your rotations, you have looked and saw, how things are in different settings and kind of made your little list, your top 10, and kind of marked them off and things will rotate. But doing the interview sometimes And then the onboarding, they're just trying to get you in. So you might not realize that that's a task until after the fact that you sat down and actually looked at that whole list of things that you're supposed to, that you can lawfully do in that setting. So even if that happens, you don't want to run off and quit the job. We might have to in the event that after discussing it, they don't want to honor, what your personal ethics is. But at least have the conversation. But like I said, sometimes that onboarding, it'll go so fast, like, wait a minute, I didn't realize I had to do all of this. But don't be afraid to have that conversation. All right. So let me show you this slide here. We're gonna look at a few questions and let's see what you think. Okay, here we go. Let's move us out the way. All right. So, which statement best defines ethics in the context of nursing practice? So, give you just a minute or so to read through and just drop it in the chat, A, B, C, or D. Let's give you a minute or so to read through. Okay. 44 more seconds. Okay. Let's see. How do we do? Let me look at the chat and see how many A's, B's, and C's and D's that we have. We have B's and C's. Let's see here. So we're saying, it says, which statement best defines ethics in the context of nursing practice? So test taking tip. Make sure that the entire answer choice is correct. When it says best defines, more than likely, it'll appear that an answer choice is correct. So some of when it says best defines, some of what you're reading might be true, but then when you read the rest of it, it might not be. So just make sure that the entire answer choice is correct. All right. So we got B and C. Ethics is the study or the examination of morality through various approaches, or ethics is a set of personal beliefs about right and wrong. Let's see, how do we do? Okay. So ethics is that study or the examination of morality through various approaches. So when I asked you to place in the chat, to define ethics, we had all different, we're kind of saying the same thing. There were different variations of that definition. But honesty, integrity, advocating, respecting human dignity, all this, keep all that in mind as we move forward and think about ethics and how we implement interventions and how we support or respect the patient's right to make informed decisions about their own care. So we want to, and then also we have that right to honor our personal ethics. Okay, let's look at this one. So I'm just going to stop sharing. Let me just do an overview of our ethical principles, and then we'll come back to it. Okay. So let's see. Beneficence. Beneficence is anything that's going to be beneficial for that client. It involves ways to promote the well-being of that patient including providing beneficial treatments and interventions. So just think about what we're implementing, that intervention that we are doing. Is this benefiting this patient? Or is it just something the healthcare provider really wants to do? Is this really beneficial? So non-malfeasance, do no harm. We want to make sure that beds are in the lowest position, call lights are in reach. We want to, if the care plan says this person needs two persons assistance with transfers, it needs this person needs to be set up, this person needs one person's assistance. We want to make sure that we're doing those things because we don't want any harm to come to that patient. We want to avoid actions that can cause harm to the patient. Avoid harm to the patient. Do no harm. And then justice, we want to make sure that we are treating everybody the same. No matter if every Monday this patient comes to the clinic because of whatever reason they're coming. They might be out of the medication or they just don't understand, how to manage whatever the disease process is a reason why they're coming. If this patient has this type of insurance, it only covers this. This person has no insurance, underinsured. Justice includes ensures that everyone is being treated fairly, including equal access to healthcare and then just equitable access to the resources. The patients might not take advantage of the resources, but we want to make sure that they at least know that those resources are available.
Excuse me, teacher.
Mhm.
I'm sorry, I don't mean to cut you off. Are you sharing, this is a PowerPoint? Are you sharing this? Oh, you're just speaking in general.
Yes, then I'm going to go back to the PowerPoint. Then we're going to do like the
Okay.
question and answer. So I'm just doing an
Okay.
overview right now.
Okay.
So no, I'm not showing the PowerPoint right now, but I'm going to come back to it. The moral distress occurs when a nurse knows the ethically correct action, but feels powerless to act due to the institutional or legal constraints. It's like, what in the world? So there are some instances, hopefully you haven't encountered, hopefully you will never encounter it. But sometimes there's some things that are just done that's incorrect. And so moral distress again is when the nurse knows that the ethically correct action, but feels powerless to act due to, the institutional or legal constraints. What do you do? What do you do? You want to always make sure that patient has enough information so they can make an informed decision. And when they ask you, well, what would you do, nurse? Remember, we don't make decisions for them, but we make sure that they have enough information. Sometimes patients will just go along. We were talking about, is this a benefit for the patient? Beneficence. They'll just go along sometimes without really understanding what the healthcare provider really is wanting them to do, whatever that intervention is, medication, some type of treatment. And if their conversations with you and the patient leans to that they need more information to make an informed decision, then we have to advocate and make sure that that information is there for them. Now, that may mean, more than likely, it is going to mean you're having conversations with your manager, maybe even with that healthcare provider. Sometimes those can be difficult conversations because it's going to appear that you're trying to go against what they're saying. But no, this patient needs more information or they have questions that have not been answered. And we cannot answer those questions for them. So it goes back to the healthcare provider. And so that's how you would just handle that part. Okay. And so we talked about beneficence, justice, making sure that each person receives equal and equitable care. So now I'm going to go back to the PowerPoint. Let's see. Let's look at this one. Now let's take what we know and see. Again, use the chat. A, B, C, or D. We'll give you your time. Okay, 21 seconds. So you gotta make sure that, if you're supposed to be on mute, that you're on mute. Okay, let's see what we have mostly. Let's see what we got here. Okay, looks like we have all C's. Again, taking tip, make sure that the entire answer choice is correct. What it's saying is correct. And also watch those words. They're small words, but then sometimes it changes the definition of, and also, just really are things always. So just got to be careful with words like always, but, and there's some other words out there. So just make sure that you're thinking about that. Okay. So non-malfeasance requires a nurse to avoid causing harm to the patient. So if you know you have a order and it's up there, it has all the components to it. But then every time you administer, we'll just say blood pressure medication. You administer medication, more than likely this person has hypertension. So it's an antihypertensive. So what's expected is that blood pressure comes back to normal or close to normal. But then we give the medication and we're noticing that this blood pressure is abnormal. It's abnormally low. It's time to give the medication again. Now we know if we keep giving that blood pressure medication, more than likely that person's going to bottom out. So it's on us, the nurse, to make that phone call or to communicate with that nurse manager, whatever the protocol is in that facility, to let them know your findings, your blood pressure measurements. We verified that this is a correct measurement. This blood pressure medicine, the order, all the components are there. It has the correct dose, it has the time frame, and it's time for me to administer this medicine again. But this person's blood pressure is 100 over 50. So it's up to us. Do we go ahead and just give that medication? Because the order is there. But then our knowledge, knowing that blood pressure is already really abnormal, what's going to more than likely happen to that client? You're going to cause more problems to them. So we don't want to cause that client, and you want to avoid harm. So just making sure that, we're just thinking through the whole client and all of those things that you've learned. You've learned how to check a blood pressure. You have to get checked off on it. You learned what different medications were. Now we put it all together when we have that team of patients. We don't want to cause them any harm. We know that blood pressure is sub low, 100 over 50. This medication is given to lower blood pressure. So more than likely, if I give this blood pressure, it's going to get even lower. This person is going to experience some type of harm. Good, good, good. All right. So what is the purpose of the code of ethics for nurses? And someone can just come off mute and just respond after you read through. What is that whole purpose of the code of ethics?
D.
Okay. The code of ethics for nurses establishes clear priorities such as compassion, respect, advocacy for patients' rights. Okay. What is compassion? What is that respect and advocacy? These are, 3 words, but that it involves a whole bunch. So what about this patient and they have, legal documentation that puts their niece in charge of their healthcare decision making? This patient has a DNR order. It's legal in that state. It's all, everything has been signed off on appropriately. But, that patient, if they, in the event that they're found, without, heart rate, without blood pressure and all of that, if we could just, in our minds, we would think in one sense, we can just push on that chest, get that blood back to pumping. But though, this person has a DNR order. Do we honor that? Do we honor what if we think the person that they left in charge, that niece, is making decisions that are not in the best interest of that patient? What do we do? Advocacy. What do we do? These are just 3 words, but it can go really, really deep, really, really deep. Okay. So what does applied ethics involve in nursing practice? Again, we'll give you time to read through and someone just come off mute and answer. What does applied ethics involve in nursing practice?
D.
Okay. Why would you not say A? Applied ethics is concerned only with legal compliance.
Because it says only.
Exactly. That's another one of those words. Only, always. And, so only with just legal compliance is so many things too that's actually involved in ethics in nursing practice. So there's another one of those words. So why did we not choose B?
Because you're saying you're debating about the morality of a patient's health.
And that's it. And that's all that B is saying. It's not saying, because it's more than that. It's more. It's more than personal beliefs. It's more than legal compliance. It's more than values. It's all of these other things, which is applied ethics refers to the process of approaching daily life situations. And a daily life situation is different. Look at your day yesterday and what's today and it's going to be tomorrow. It's different. So it's not just these things that they have listed out separately here. It's with ethical theory and reasoning to daily life situations. Remember that I think last week we talked about that reasonable, prudent person. What's a reasonable response? Okay. What does the principle of justice require in nursing practice? And you can come off mute and respond to this one as well.
D.
D.
D is in Danny.
Yes.
Okay. So
D as in
why is it not A?
because it's not about following the policies not really about following the policies, is what I think.
Where are those policies at?
Under the nursing.
In the hospital.
A is just referring to the hospital. Is that the only setting?
No.
No, that's not our only setting. So, like I said, remember our policies are supposed to match our nurse state practice at which, matches, all of that, all the things that we can lawfully do. But this is just talking about the hospital. Well, what about all those other settings? So those are just some answer choices are just place fillers. So just make sure that you're reading through, think it through, and make sure that it's saying what you know that is correct. Okay, so justice in nursing ethics means treating the patients equitably, equal, and fairly. Okay, so what is the scope of bioethics in healthcare? So bioethics deals broadly with ethical questions surrounding biological sciences, healthcare technologies, and health policies. There's so many pieces and moving parts to this. And then health policy, what guides what we're doing, what, people getting claims back. This, the blood work that they got done, it was denied. The insurance is not gonna pay for it. Patient has to pay for it. Where does that come from? What information guides? Well, it comes from these health policies. The information, this evidence-based information that's out there, did that doctor just order that lab work haphazardly, or was it really related to what's going on with his client? And then what happens? You have those nurses that the reviewers, they come back and look in the documentation. That's why it's so important for us to document every shift or whenever it's required for us to document. It's so important for everyone on the healthcare team to document, because if they go back and look at the documentation, that record from that patient, oh, well, this patient doesn't have a diagnosis of this, but they're exhibiting all of these signs and symptoms, so more than likely, that's probably why that doctor ordered this test or this medication. And so that's where that PA, that prior authorization come from. Normally that medication or that test is not honored for what's on that patient's medical record. But if they look in the documentation, they have all these signs and symptoms and these previous treatments and things that have been tried and does not work for that client, then more than likely insurances will pay for that, those tests and things, that the tests and the exams that the doctor and the medications that the doctors are trying to order for that client. But it goes back to what those policies, what information have we gathered to say, hey, this is treatment for this? Because there are so many medications out there that they were designed for one thing, but we're realizing now that they can help so many other things, as reasons why they were, which is not the reason why they were designed. I know everyone remember it's probably been 2 or 3 years now when Ozempic was realized, for those that wanted assistance with weight loss. It was designed, for diabetics, but we have all these other off-label uses. And there's so many medications out there. They were designed for this, but we found out that they help other chronic disease processes. So there are factors that commonly influence the development of ethical practice in nursing, and it includes the workplace, family peers, family and peers, and then education. Okay, so I'm going to set my timer here, and I'm going to let you read through this, and in the chat, put A, B, C, or D. Pull my timer up. Okay, got a few more seconds, but let's go to the chat and see what we are seeing here. We have mostly second answer choice. Okay. Okay. And so what's the nurse's best response? So a person can say all of these things, but it's asking you what is the best response in relationship to veracity. And that is truth telling. Something, even if something has went wrong or happened wrong, we just tell the truth. The patient needs to be informed. So veracity is, telling the truth about whatever it is, the situation that's going on. So which one of these is the best response? They're asking about this medication. Does it have any side effects? Yes, it does. And some common ones are. You can let them know what they are. But no, there are no side effects. Don't worry about it. You'll be fine. I don't know. Maybe ask your doctor. And so, we've learned medications and their side effects and everything. So remember, you want to tell the truth. So yes, it does. And some of the common ones are. We don't know if you experienced it or not. But when they're doing like the trials and everything, if one person says they had a headache in response to trying out that medication, they have to list it as those side effects. Yes, these are the side effects. Do we know, will you experience any of them? We don't know that part, but yes, they do have side effects. Okay. What is the nurse's responsibility when witnessing potentially harmful behaviors in the workplace? Hopefully we never run into this, but you never know. So how should the nurse respond? witnessing potentially harmful behaviors. This back right here, you can see. What is the nurse's responsibility when witnessing potentially, we don't really know, that word is potentially harmful behaviors in the workplace? So come off mute and tell us what you think.
D.
D.
Bobby and Danny, or are we just saying Danny?
D as in Danny.
Okay. So what's wrong with A?
Because you're choosing to overlook certain things or just tell it when the supervisor asks you instead of you being mandated to see, or if you think that it's abuse, you should report it.
Okay. What about B and as Bobby? A nurse should ignore minor ethical concerns.
You shouldn't ignore any concerns.
Got it. Okay. Okay. Good. So a nurse should report any observed behaviors that are potentially harmful to the clients. Even if we don't have confirmation and someone said the word mandated, we as nurses are what? Mandated reporters. So do we have to confirm and know all the details of whatever it is that we're thinking that's potentially harmful?
No.
No, we don't have to do the investigation, but we are mandated reporters in the event that, there is some evidence or we think that there is of some type of potentially harmful thing being done, behavior, something being done to someone. We're mandated reporters. We have to report it. We don't have to have confirmation. We don't have to have all the details. We don't have to do the investigation or any of that. Okay. So beneficent paternalism, I don't think anyone knows what this definition is. Can you explain, anyone wants to explain what beneficent paternalism is?
That's when you're like trying to influence them to do whatever like the doctor's saying.
Okay. And so it's like the opposite of advocacy. It's the opposite of autonomy. Autonomy is what? What is autonomy?
The
Autonomy is
patient,
where the patient have the right to make their own decisions.
Okay. One other person. What's autonomy?
is their right to decide if they want care or not.
Okay. So it's their right. So we're saying beneficent paternalism. The healthcare provider is saying, hey, I know what's best for you. I think you should, receive this treatment or allow this procedure to be done. We could have a scenario could be we have the patient in room 201. The parents have decided to refuse whatever the treatment option is, medication, a procedure. And the healthcare provider, he or she has been informed. And the healthcare provider said, nope, nope, nope. Based on, and they don't just outright do this. It's usually only done during emergency situations. And the healthcare providers, they usually just want to make sure that they've exhausted all means just to make sure that whoever's making that decision, whether or not it's a parent or guardians or the patient themselves, really do understand, have all the information to the nth degree about whatever it is that they're trying to recommend. But it's beneficent paternalism is really like the opposite. It is the opposite of autonomy. It is saying, hey, the healthcare provider knows what's best for you. Nope, you're refusing this treatment, but you really should be taking this treatment. And usually, like I said, used for extreme circumstances, emergency circumstances. The courts are petitioned. Now, it does not mean that the courts will go and approve what the healthcare provider is just recommending. It just means that they are having that last chance to make sure everything is out there so that, again, these patients can make an informed decision. So beneficent paternalism is an attitude where the nurse assumes they know what is best for the client, disregarding the client's input. So it is the opposite of autonomy. And so usually it's an extreme circumstance, and they just want to make sure that they really do have they're making an informed decision, that that last explanation is actually given. So the primary functions of the ethics committee is they assist with difficult ethical decisions in healthcare settings. So you get hired at a facility, most, I want to say most, for the most part, all those healthcare organizations have an ethics committee, but usually it's not something that you talk about when you're onboarding or even in that interview unless you bring it up. But once you get hired and you seek out what other opportunities are there within that organization, ask about the ethics committee, quality insurance committee, health, what's the one that they do? It's called like a PI, like if they have events and things, you're that committee that goes out and you're like the face of that organization. But the ethics committee, their primary function is looking at issues that will arise. They're going to arise in healthcare settings. And you would sit on that team to listen, to make sure that all the components, we gathered all of the information, and to also seek a solution to whatever that ethical dilemma actually is. So this is a committee that you can ask to work on. Sometimes there's extra incentives, sometimes there's not. It's just an additional task that you have to complete. But if this is something that you're interested in, you can ask in an interview or either after you have been hired at that facility. Because for the most part, all of them have that ethics committee, and things will come up. Okay. The role of critical thinking in nursing practice, you all. Critical thinking helps us to sort through, to be able to pivot. The bigger picture is providing that best care you can for your clients, no matter what comes up, and things will come up. That client, you could have just left out of the room. Everything was fine. That family member comes in, the patient, there's a change in mental status. What do you do? Or you go into that room. You just made a rain. You just went in and gave medications, but you knocked on the door, went back in, and that client had a change. The example that I gave earlier about the client having the do not resuscitate, but based on the client's status at that time, CPR probably would bring that patient back. But because of our legal responsibilities regarding that client's care, that DNR order is legal. But nevertheless, critical thinking helps us sort through all of that information that we have gained as nurses. We've learned about vital signs, we've learned abnormals, normals, organs, body systems. And critical thinking helps us to think through, no matter what situation we knock on the door and we walk in and the client is like, presenting like this. Emergency, they roll through the door and, they have the client on the gurney and, they're, the EMS, they're, telling you all these things that's happened in the field and on the way to the emergency room, what was going on with the client. That critical thinking helps us to sort through all of that information that we know and hopefully make the best ethical, legal, within our state practice act decision for that client, so that client will have the best outcomes. Are there any questions about any of the information that we went over thus far? Because we're at the top of our first hour, we do need to stop and take our first break here. Any questions? We talked about different ethical principles, test taking tips. Any questions? Let me stop and look in the chat. There aren't any questions in the chat. And so remember that these, even though we're on break, we still have to leave the recording on. So just make sure that you're on mute. You can turn your cameras off and it is 6:30. So we'll see you at 6:35. See you in 5. All righty. Come on back in. So I'm going to send this PowerPoint to your emails in Canvas. There are 3 slides. We're going to do just break out and look at these 3 slides in small groups, and then we're going to come back and discuss them. So let me wait on it to attach in your Canvas mail. So hold on, it's not there yet. Okay, so hit refresh on your Canvas mail and you should see it says week 2 in-class activity. Okay, so the task is opening up that email that's in your Canvas. Will give you maybe like 5 minutes to look at it, discuss it, talk about it, and then be ready to share out with the group. So accept the invitation in the breakout room. I set my timer here and just do some jot noting. So you'll be ready to share back with the group. Accept the invitation to the breakout room. Let me set my timer. And I'll just circle it around just to hear your conversations, but you'll share back out when you come back as a whole group. Let's see. And start. Okay. Miss Brooks, did you get the invitation to the breakout room? There we go. Miss Creighton, are you there? Do y'all see the attachment in your email, your Canvas mail?
That's what I'm trying to pull up now.
Okay.
For what she did, for the question, what we think she should do. What about maybe trying to talk to the doctor? What y'all think about that?
Yeah, ready to share out?
Not yet.
Okay, need a few more minutes. Most of the groups need a few more minutes, so okay.
Quick question.
Mm-hmm.
Are we going off of veracity?
We should. I mean, you want to, so I can't like really say, but what is veracity? If you think that's it, are you asking, is that the most important concept in the scenario, or are you just using that to guide your responses?
So we a little lost. So we are answering these questions. So you sent us something in our Outlook.
Not in your Outlook, in your Canvas meet.
I didn't see that. I see. Is it dealing with let me see. Conflict of interest, moral distress.
You have the nurse, the scenario about the nurse.
Let me see.
Let me share my screen here. It should have went to your Canvas mail. And veracity is the first slide.
Veracity is with the
And then conflict of interest, moral distress. Sheila is a registered nurse.
Yes, ma'am. Yeah,
okay, that's it.
Truthfulness and honesty
all right, thank
require
you.
nurses to provide patients with
And I got a question.
and unbiased information about the diagnosis.
I got a question.
She has a
Are we
question.
the only two in this group? We are
We're
only
gonna do it in a
two.
whole group. I'm gonna spin the wheel. If your group number come up, you're gonna have to respond to us.
She's trying to see why we only got 2 people, and and I guess her classmate got 4 people.
No, no one has more than, all groups have 3. I mean, all groups have 2. There's only one group with 3 in it. You're talking about the group project. This is not the group project. This is just something we're doing in class.
Okay.
Oh,
yes.
okay.
There's only one group with 3 people in it. Everybody else has two people in the group. No, there are 2 groups for 3 people. But yeah.
So that's what it is, basically the veracity.
Oh, all right. Then I got it. I thought it's about the group work.
No. This is not the group project. This is not week 10 stuff. No. Not week 10.
Okay, I got it.
He doing something to benefit his wife.
Okay, everyone should be back in about 47 seconds. We'll get started.
Okay.
$47 We'll have everyone back. So this was not associated with week 10, you all. This is just us week 2 just doing, going in small groups. So this was not associated with your group project that's doing week 10. I think we have everyone back. Let's see. No, Harry's not back. We have 3 that's not back yet. Okay. A few more seconds. So before we start, tell me who does what. And the who's are the RN and the LPN. So my question to you is, who does what? Who develops nursing care plans? Your options are the RN or the LPN. Who develops nursing care plans?
RN.
I think I heard only the RN. Was that everyone's responses?
Yes.
Okay, that's correct. Who does what? Of course, we have the RN and the LPN. Who administers medications?
It depends.
LPN.
Both. Both can do it.
There's
Okay,
certain meds the RN can do that the LPN can't do.
okay. All right, so we're all in agreement with that. All right, so who does what? Who does a comprehensive or in-depth assessment, that's physical assessment of all the body systems. So who does what? Who does a comprehensive, in-depth assessment of all the body systems?
The
RN.
RN.
Okay, we all agreeing on that. So who does what? Who can collect patient data, do assessments, but it's not in depth?
PN.
PN.
Okay.
Yeah.
Who does what? Who can delegate tasks?
Both.
Both.
Okay. All right. I didn't hear any conflict in our responses, so we'll move forward. So we're just going to review here just critical thinking. We talked about critical thinking before we went to our small groups. So critical thinking involves purposeful thought process. Hopefully, we'll have positive outcomes. We should be thinking about what's expected, what should be happening. And what we're doing is should be evidence-based decision making, considering the circumstances, but it should be evidence-based. And it does include the nursing process, which includes, gathering all the information, the assessment, vital signs, including what's in the environment, collecting and verifying the data. We should be looking at clients' needs. What can we use to solve the problem? Meanwhile, by being, also being safe. We want to be safe and we want the patients to be safe as well. We do want to gather enough information, hopefully facts and the truth, around what's available. We don't want to assume anything when we are gathering information. Well, I just, the patient went in, they had also mental status. I just assumed that it was their blood pressure medicine. Well, how do we know that? We check the blood pressure. Has the patient even have we even given the blood pressure medicine? So we want to make sure that we're making discussing the facts and making our decisions based on what is factual. In order to provide that optimal care, critical thinking, we need to be observing, analyzing, and planning. It's just like just a fluid process. We should be doing it all along. We do want to apply the knowledge that we know. Recall what you know to be normal for that blood pressure, that glucose, and then compare it with what the findings are that you're getting for that patient. That will help you problem solve. And, the normal long sound should be clear, but we're hearing bronchi, we're hearing crackles. Make that comparison and then discuss it with the team. And that will help you to provide that optimal patient care. What does this patient need? So consider the scenario or the situation. We have a patient in 201, 202, and 203. All of them might have hypertension. All of them might have just had hip surgery. The person in room 201 has just had hip surgery and they're day 2 post-op. And that's all they're there for. They don't have hypertension. They don't have diabetes, but the patient in room 202, 203 may have a mix of those. I said all that to say that we want to provide that individualized, tailored to what that patient's need, and we adjust it accordingly. We want to be safe. We want to make sure that we are comparing the norms versus what we're actually getting from our assessment findings. Now, sometimes there's some algorithms that will assist us in making sure that we are just not haphazardly pulling things out of the air, so that we're following those standard-based approaches and those evidence-based decisions. All right, so now let's go to our little situation here. Let me pull it up. And we have a wheel so that we can make sure that we're sharing the love. We hear responses from everyone. So let me spin our little wheel here. I guess I could do trying to share my several screens so I have to keep toggling back and forth through them. Well, let's see, can I do Got my wheel up. And then I need the groups up. You see, can I pull the groups up? Trying to make sure we do it all. Let's go here and let's see if it's gonna open right. Okay, I want this one. I have one more window you all want to share. This technology is a beautiful thing if you know how to use it correctly. Okay. All right. So it's gonna be jumbled. I may have to just stop sharing because it's a bunch. I was trying to do all 4 screens at a time. Let me stop. Let me just do one at a time. Okay, let's spin the wheel and then we'll see who's gonna share out. Okay, where the wheel at? Well, stop sharing. It's the user, y'all. It's not my computer. It's the person that's using my computer. Okay. All right, let me just do this. Spin the wheel, then we'll go to the groups because you all might not have known the group number. Okay, there we go. Spin. Okay, so let's spin here. So we want to hear from okay, group 6. Hold on, I'll tell you what we want to hear from you. I'll go ahead and do 2. Looks like group 4. Okay, so group 4 and 6. Okay, so we need someone from group 6 and group 4. You all talk us through the first slide. So read it to us, talk us through it, and tell us what your answers are. Group 6 and 4. So you're on the screen, and I'll just be quiet and let you all talk us through it. Room 4 and room 6.
Do you want us to read what, did we all get the same PowerPoint or no?
You did, but just read it again for us.
Okay, so the first question, it said sorry, I'm in a classroom with other people in a different class. An ethical dilemma can arise when healthcare professionals struggle between telling patients the full truth about their diagnosis or prognosis and fearing that such information may cause psychological distress, loss of hope, or worsen a patient's medical condition. This is an example of versus uh benef benef
Benefiance.
that and
Okay.
non-maleficent and then justice.
Okay, so that was group 4. Group 6, talk to us and tell us what you got. And then we'll see if we all came up with what we came up with.
So I guess we'll go with number 2. What are the potential consequences for patient care and trust if the issue is not addressed? Can we do that one?
You're doing the slide that says veracity, right?
I believe, yes. It was questions at the end about Sheila.
No, we ain't got that far yet. We still on
Oh,
we ain't got that. So the same slide that Tuesday and Destiny talked to us about. So tell us what you all. Let's hear from you all on this slide. Truthfulness, honest communication. This is an ethical dilemma can arise. So what did you all come up with?
Can you come back to?
Ooh, the wheel picked you. I didn't pick you. All right. So do you group 4, tell us again. What is your answer? Let me stop
We
sharing.
did
Movies.
A, I believe, right, Tuesday? I'm pretty sure. Yeah, A.
Yes, A,
Yeah.
benefiance.
Good and not lie.
Because we were saying the definition of the benefiance was the code of ethics for nurses establishes clear priorities of compassion, respect, and advocacy for patients' rights. So that's why we chose benefiance.
While you are not in group 4 or 6, do we agree with beneficence, the other groups, or we think it's
Yes.
something else?
Oh,
Yes.
beneficence. I was saying it wrong.
It's
Yes.
okay,
Yes.
me too.
But it depends on beneficence. It depends on who you talk to, So do we agree or we think it's something else?
I agree.
I agree.
Okay. Okay. So let me read it. An ethical dilemma can arise when healthcare. So first of all, veracity is truthfulness, honest communication, just telling the truth. No matter if it's good, bad, or ugly, just whatever it was is what it was. Okay. So an ethical dilemma can arise when healthcare professionals struggle between telling patients the full truth about their diagnosis or prognosis and fearing that such information may cause psychological distress, loss of hope, or worsening a patient's medical condition. This is an example of veracity versus. So, what is your definition of veracity?
To tell the truth.
Tell
I
the
think I
truth.
totally read that question wrong.
Okay, so now what okay, so tell me now what's your understanding of what the question is asking you now.
No, nothing.
Um, I would say justice.
So let's stop. What is the question asking you to answer? So identify what the concept is. One of the concepts is veracity. But what is that question
What is
asking
it's
you?
saying? What is it's the mhm. Is it veracity versus
It's about justice
whichever one, A,
because
B, or C?
Is it
B
veracity versus ethical principle?
an ethical principle. Which one of them? All of them. So
It's
which one of
B.
the
I
ethical
mean,
principles?
B.
group two, we chose B.
Oh, what is B? What is give me the definition of now non-malfeasance?
Do no harm.
To do no harm or remove harm.
Do no harm, avoid actions that could cause harm, or avoid that patient harm to that patient. So we got a scenario. It's like, okay, this patient, healthcare professionals all the time, they struggle with telling the truth, just saying what it is. That's the veracity. But then we have a patient that has a diagnosis and a prognosis that's probably not positive. So it's probably this person probably is going to get some news that is going to probably, it may not damper their hope, but more than likely it could worsen their patient's condition. They may lose hope, and they may induce psychological distress. So the question is asking you, not only are we going to tell the truth, but what is it? What are those two principles that that healthcare professional is going to be wrestling with? Which is veracity, telling the truth, and also doing no harm to that client. So that non-malfeasance. So just like someone said, well, oh, I thought I read that question wrong. Make sure. So the correct answer is B. That person is wrestling against veracity versus non-malfeasance. I want to tell the truth, but I don't want to cause this person any harm. I don't want, because sometimes we don't think of as psychological distress, a loss of hope as harm. So had we not talked, I don't know if you have ever heard, well, that person went downhill after they found out, whatever they found out. Have you ever heard of that? The person, they were doing fine until they went to the doctor and they realized they had high blood pressure or something. And, then their health decided to decline. Have you ever heard of a situation similar or something like that? And so in this scenario, non-malfeasance is doing the patient no harm. Sometimes we don't think of loss of hope and psychological distress as really something that'll harm a person, but it can. If a person lose hope, there's a diagnosis of failure to thrive. It's like you can't find anything physically wrong with this person, or they may have some physical conditions wrong with. They may have hypertension and some other things, but this person they just won't eat. It's no, they just won't interact with others, their family members, or the other people that's in the community, because they might have some psychological distress or loss of hope. And that is, had we not told them, then did we really do harm by telling this client or patient that they had hypertension or cancer or whatever? So that's the scenario. That person is struggling with, do I just tell the truth, no matter what it is? And we do tell the truth, but should we tell all of the information right now? Does this person need another family member in their support system to be with them while they receive this news? Do this person need to be over the phone, or should this person really come into the office and it be a face-to-face conversation? And sometimes, even though we're going to tell the truth, it's received differently because of that presence of us face to face with them, or because they have that support system that's in that physical space with them. So someone tell me, what do you think about that question? Was it a trick question? What do you think about, now that we found out what the answer is, and several of you had the aha moment, what the question really was asking? So how can we go forward with looking at questions like that and making sure that we're answering what the question is actually asking us? Anybody, what's your tips?
Actually read it and not skim it, and look at what the question asks you, then go back and read it again, and then fill in the answer.
There are so many times we're doing like exam review, of course, after the exam. We take the exam, we have to wait on everyone, all the classes, to take the exam. Then we have to do an exam analysis just to make sure everything was good. Then we post the grade. Students will get the grade, and they want to meet just to discuss whatever it was that they missed. There's probably 1% of students that actually still get the answer choice incorrect after we meet and they actually realize what the question actually was asking. There's only 1% that don't. Most of the time, 99% student answers right off. Oh, well, I didn't realize that's what the question was really asking. So that's a test taken too. And like I said, most of the time, it's not that you all don't have the understanding of the information, is that you haven't sifted through to see, well, what is this question really asking? What is the question that they want me to answer? Because it'll give you all of this information, but it's asking you a question about this rather than that. Anyone else that would like to give us a tip or something to think about as we read through, and as you just think about, as you go in to take care of your patient, you going in, you're trying to decide, what are the top 3 or the top, 4 things that's going on with this client. What can help you narrow down your focus? She said, make sure that you're actually reading the information that the question is actually asking. What else, you all? Or is it?
I think you should focus on the main concern, complaints as far as the patient.
Okay. Consider, for the most part, we consider like blood pressure, glucoses, those things that are tangible, like we can see that number, but you can't really put a number on hope or physiological or psychological distress. But those things are just as real as that blood pressure is 120/80 or that glucose being 40. Those things are just as real. So don't dismiss those other components. All right. Thank you, group 6 and 4, and everybody else that jumped in. Let's go back to this wheel. Now we're going to move on to our little scenario here. We have Sheila, the registered nurse, admits the patient. So let me try to do this wheel here. So, you have the time for the exam. Make sure you take as much time as you need. Don't run out of time. But make sure that you're taking time to read through and and make sure that you're answering what's being asked. Okay. So I really should have taken out 4 and 6. But anyways, if 4 and 6 pop up, we know that they don't have to respond here because we've heard from you all. All right, so let's spin the wheel again. Let's see here. Oh, got 6. Nope. Oh, it's on 6 again. Let me take 6 out. Bad choice. Oh, it did not take 6 out. Okay, let's spin it again. Oh, was that 5? Wait a minute. Was that 5? That was 5. Sorry. So group 5. Let's spin again. Okay. Group 4. 5, 4. You take it out. And then we're left with just group 1 and 2, right? But let's see. What order will we go in? So 5, 4.
Take that out.
Take out group 6. Hold on. All 4 have already went. You're right. I'm sorry. I'm trying to give it back to you all, group 4. So now we have 5, then 3. But group 6 and 4, you all are back up now, just in case. And then let's see who will go next. 5, 3. Okay, then 1 and of course 2. All right, so group number 5. Let's see what you got for us here. Let's see. So group 5, if you would talk to us about what factors are contributing to Sheila's moral distress. So let me share our scenario here. Okay, so group 5 will do the first one. Group 3 would do what are the potential consequences for the patient care and trust if the issue is not addressed. And then group 1 does the last question. What should Sheila do in this situation? And then group 2 would do what support systems can the nurse use in the hospital? So we'll go in that order. So now let me see. Who is group 5? Who's in group 5? Group 5 was Middleton and Grant. Middleton and Grant. So tell us all about it. What factors are contributing to Sheila's distress?
I think that because it mentioned that the doctor was respected and known, she might be apprehensive, excuse me, and telling, the unit or a unit manager about what's going on because that is his wife. So if he's accepting it and other people respect him, then that might keep her from wanting to say something.
Yeah, she's I agree with her. I feel like feel like her back is up against the wall. Like she want to do the right thing, but because he's well respected, and everybody else is going along with it and brushing everything he do under the rug, she feels like, I mean, who is she up against everybody else?
Okay. So moral distress occurs when the nurse knows the ethically correct or the person knows the ethically correct action, but feels powerless to act due to the institutional or legal constraints that are out there. Okay. Do we agree? Or do we have anything else we want to add? That they
No,
pretty
I
much
don't agree with it. I think that she should speak up, even if, it takes,
you
excuse
went
me,
back
even if
on
she
mute.
may get backlash or, but as being a licensed professional and that's her job to just do the right thing. That's where your morals come in at.
Okay.
And we're all mandated reporters, so even if she don't report it, somebody could come behind her, report it, and she's already documented, something totally different. So she could basically get in trouble with that too.
Okay. All right. So that's jail time, fines, and loss of licensure. Okay. Anyone else? All right. Thank you so much. Okay. So group 3, what are the potential consequences for patient care and trust if the issue is not addressed. Potential.
The doctor will keep doing it to other patients.
Oh, I'm sorry. Did I say who was in group 3? I'm sorry. Hold on. Did I already say who was in group 3?
No.
Okay, hold on, Sierra. Hold that thought.
Okay.
You might be in group 3. I'm just trying to make sure we share. And you are in group 3, Sierra. Sierra and Kenya. Milton. Sorry. Okay, go ahead. I'm sorry.
Yes.
Yeah. Just the thought that the doctor might keep doing it to other patients, doing wrong tests or ordering more than what's needed.
Well, it's the doctor, isn't it? We just go with what they say.
But then it says that the receives a substantial bonus for increased test volume. So they're doing it for more money.
Yes, he's benefiting off of the
Yeah.
patient.
But
And
the
that's
health
something.
policy says, so there is a policy out there that says, and so this is they don't really advertise for this job as a nurse. I think it's an additional task where you go around and you do, it's falls on the quality where you ask these questions and then you go back and look through the charts and make sure that, everything has been checked off on and everything. And as a result of that, the hospitals and things, they get these ratings. Now, I don't know if these ratings are tied to monetary values or anything like that, but I know they do get these ratings. But what you all are saying, I agree with what you're saying. No, that shouldn't be, he shouldn't be getting kickback. These tests are unnecessary. Then, patient may end up having to pay for these tests and things. So I agree with what you're saying. But so as you think about, well, why are they, asking these questions? But there is something how do these hospitals and places get these ratings? Well, they come back and look at all of this stuff and see if, what the patient outcomes, were the patient satisfied. Some things are subjective. And then those objective things is, well, hey, this person, were they a readmission? Did we discharge this patient too early because they kept having to come back to the hospital the next day? There's some, I don't know if you all have been in some settings where patients are admitted, for example, to the long-term care, or they admitted you were rotating with home health and this patient was at home and it's like, what? They let you left the hospital or let you left like this? And so most of the times those patients have to go be back readmitted. And so the insurances, they look at the rate of readmissions. Well, what's supposed to have been done, that algorithm, was it followed? So a nurse actually goes and look at that and see, and then that's how they get those ratings too. But it should not be tied to, someone's personal gain because they're ordering tests and doing all these things for a patient. Okay, so we heard from anyone else would like to add anything about potential consequences for patient care and trust if the issue is not addressed. What about that facility? It gets out that, that facility, that this is going on. What's going to happen with the number of people coming to that facility?
They can
It'll
stop
decline.
coming.
They're going to stop coming. Exactly. And what's going to happen? It's going to domino effect. They stop coming. Patients are not coming. They don't need healthcare providers. That includes nurses, everybody on the healthcare team. They don't need us because who we're taking care of if no one's coming. So more, the right thing is to do is just to address it, report it, even if we don't have, all the facts and everything. All right, great. So group number 1 has, what should Sheila do in this situation? And let me see who was number 1. What should she do in this situation? And then my little mouse, you all, is doing something. It's not going where I'm telling it to go. So group number 1 was Anderson, Creighton, and Prey.
Yes.
Yes.
So
What was the third question?
what should Sheila do in this situation? The last question, the first part of it, and then group 2.
Advocate for the patient.
Okay. Advocate for the patient. So what would that look like, advocating for the patient in this situation?
Protect the patient from the
unnecessary test, potential harm.
So what would that look like though? Like, would that be a conversation? Would that just be something you write down and slide up under the manager's door?
Conversation.
Like, with who?
With like the charge nurse, patient. It could be patient advocate too. Social workers, like anybody of the chain of command.
And also I agree with that. What about that ethical committee? You think that would create an ethical concern or
Yes.
issue?
Yes.
Exactly. And that's why I say, that when we talk about that ethical committee, things they're gonna come up because you're gonna, see people doing things that they should not be doing. It's gonna come up. So that ethical committee, all healthcare facilities and organizations have, because things come up. Even though you're going in and doing the right thing, the correct thing, there's sometimes people that don't do that. Okay. All right. So last group, number 2. What support systems can nurses use in the hospital setting? So we're talking about the nurse. Because we need that support too, because that's a lot, you all. You realize that this is going on, and you're like against like this doctor and world renowned or whatever. And so that's some stress. So what support systems, because we know the correct thing to do. We're gonna tell the truth, but we need some support. What support systems might we need? Group 2.
The nurse manager, supervisor.
And who else? Group 2, Brooks, Clark, and Harry.
What about, I know in some hospitals they have like resource nurses, which is like older or nurses that have been nurses for some time. They have like a resource team for nurses.
Yeah, and they do call them different things, mentors, different.
Right.
Yes.
Things of that nature, though. It's the same idea, yeah.
Mm-hmm. And who else?
Whistleblower protections.
Ooh, whistleblower. What is that whistleblower? What is that?
Maybe someone that, I mean, of course they can address the issue, but I mean, I don't know.
Support system. If we're gonna blow the whistle, we have a professional obligation, y'all. Anything that puts the patient at safety, we must report that to the proper chain of command. And when you whistleblow, we as the nurse should be protected, and the patient should be protected as well. Right. So what else might be part of our support system? We probably gonna need a what?
HR.
HR.
Risk management.
OSHA.
And like you say,
a
lawyer. Committee.
A lawyer. You'll probably need a lawyer. So hence, you all more than likely have insurance now while you're in school. You have student insurance. And so when you get out, you're going to need some insurance when you get your license as well. And a lot of these professional organizations that you might end up, like the ANA, American Nurses Association, they do have lawyers. They have this whole legal team, because unfortunately things do come up. You're that whistleblower because we have that professional obligation. We are mandated reporters. We have to report information, whether or not we can confirm the evidence or not. We still have to report these things. So a part of the nurses support system is that legal team, that lawyer. And sometimes it might have to be someone outside of that hospital's HR. Because think about it, that person is working in HR where they're there for you, but if it's something against that hospital or a person that also works there, you might need someone that's not attached. So yes, that lawyer, we're going to need that lawyer also, good, as part of that support system as well. All right, and let me stop and see if we have any questions or anything in the chat. Okay, nothing in the chat. So we are at the bottom of our second hour. So we will pause and take our 5-minute break. When we come back, we're going to finish reviewing concepts, and we're going to get in our group 10 groups. And then, of course, we're pushing all our time toward the rest of our time toward the end to take the break at the end. So, we'll leave before the assigned time. So let's take a 5-minute break. Remember, this recording still plays, so you can turn your camera off. Make sure you're on mute. We'll see you in 5. All right. So we will spend 13 minutes in our group 10 to talk about do reintroductions and just kind of look at the rubric. You don't have to make, I know we're missing some people tonight. You don't have to make any concrete decisions, but make sure you get an understanding of that rubric. Like I said, most of the time it's not because you don't have the information, it's just because you didn't really understand what was being asked. So I'm going to put you in your group 10 groups for about 13 minutes. The task is looking at that rubric, looking at your topic, and sift through what are all those main concepts, what are all the moving parts that make up your topic, and what should you make sure that you cover in your actual PowerPoint presentation. There's not a slide count, but you do have to do an oral presentation, and we'll do that during week 10. And so just start thinking about what that's going to look. And it's going to shape up as we continue each week until we make it there. Of course, again, you cannot complete the project during this class, the little few minutes that you get, each week during class time. So you have to, decide how you're going to communicate. I can think of, well, hey, I think I want to do this part of the project, but then once you get out there and start looking up peer review articles, you run into a roadblock. How should we handle that? How do I report back to the group? How often are you all wanting to meet? Just go ahead and just break the ice and initially look at the rubric, your topic, and what do you think all the moving parts. Go ahead and identify the moving parts to your topic. Going to open up the breakout rooms, going to set my timer. Then once we come back, we will finish up our content, and then we will go on our last break, which will take us on out. So we have 13 minutes to do this, and then we have about another 15 or so to finish up our content. So I'm going to open up the breakout rooms, and I'm going to, come around just to answer questions if you have any. So accept the invitation. This is week 10 group here. All right, everyone should be coming back in. Let's see. 33 seconds and everyone should be back. Okay, I think we do have everyone. So again, refer to the group, the names that are posted in the announcement. I will go back and add in the emails, and that way you all can send out a group email, and then that way you all can decide if you all want to exchange numbers, however you all want to communicate thereafter. But I will go in and put all the emails in one place. So I'll update that document. All right, and then remember week 3, we do not meet. Week 4, we come in for the first exam, and then we will have class thereafter. Make sure that you go back through the classroom recordings, this last week's recording and this one for exam 1. Week 1, we did the orientation part, so you can fast forward through that part, but go to that content part. Okay, so we do have a few more minutes left before we actually go to our last break. So I'm just going to just make sure I go over all of the concepts, just to make sure I went over everything. If you have any questions or concerns, please feel free to stop me. But otherwise, we'll just go ahead and review everything here. So professionally, we can lawfully provide an intervention. Professionally and lawfully, because we've gotten our nursing, we've made it through nursing school. We passed that NCLEX exam. And then we have secured licensure in whatever state. So in that state has a Nurse State Practice Act. Those are those things that we can lawfully provide. Those are the interventions that we can lawfully implement, that we can do. We do have professional ethics and we do have personal ethics. And sometimes those two ethics, they might not agree. I can lawfully implement an intervention or do an intervention, but personally, I might not want to. So I would need to discuss that information, those concerns with my manager and see if there are any alternative responsibilities. The manager might not know that that personally you might have an issue with whatever the task is or the intervention that you're being asked to complete. But we do want to make sure that we're being, because we do want to respect both professional and personal ethics, but we also want to make sure that this patient receives the care that they are supposed to. So it's just a matter of having that conversation. We'll identify, what your personal ethics is, and then identify whatever it is that, the conflict is. But we do want to be honest. We do want to work with integrity, and we want to advocate for our clients. We want to be respectful for all humankind, and then autonomy, respecting that patient's right. That client has a right to make a decision, and we support them in that decision. But we do want to make sure that that patient has all of the information that they need to make an informed decision. If German is my first language and you present information to me in Spanish, I can't make an informed decision. I don't even know what the information is that you've given to me, right? Because German is my first language. I don't even speak Spanish. So I need it in whatever language, that it is that patient needs. Again, we provide that individualized care. So don't check off this patient can make an informed decision if it's not at my grade level, if it's not in language that I can even understand. Even autonomy, we respect that patient's decisions, even if it conflicts with that healthcare provider's recommendations. We don't want to hide information from the patient. We don't want to ignore the patient's cultural beliefs or their concerns. And we don't want to encourage the patient to make a decision based on what we think. So a lot of times patients, because you have established that therapeutic relationship and they trust you because you're there, you're providing that best care for them, and they'll ask you, what would you do, nurse? We always put it back on them. Ma'am or sir, we're going to support you in whatever decision you make. You need more information. So we just want to make sure they make that informed decision. Beneficence involve acting in ways that promote the well-being of the patient. And that's making sure that whatever that intervention is or that treatment, make sure that it's beneficial to that client. Not, the scenario that we just went through, it's not something that we're just doing to gain a rating or so that the healthcare facility can gain more dollars. That making sure that whatever that intervention is that we're implementing, that is really a beneficial treatment for that client. We do want to be culturally competent because that allows us to, provide that best care for our clients. So how can we be culturally competent? It means that we need to be actively learning about and understanding what our patients' cultural beliefs are and respecting whatever those diverse values are and providing that individualized, that unique care. We don't want to make assumptions. Just think about if you were the patient and the patient was the nurse, you would want your beliefs and things taken into consideration. You will want to make sure that you had all of the information that you need to make an informed decision. We talked about justice. It ensures that treatment is rendered fair. It ensures that healthcare delivery, no matter what the person's pay status is, whether or not they have insurance, but it's not enough, no insurance. Even if that person has enough insurance, we don't want it to be where we are abusing overuse. We're ordering tests and doing all these interventions and they're really not beneficial to the client. So justice ensures that fairness is, being done when healthcare is being provided. It includes equal access to healthcare and then equitable distribution of resources. So if a client they need, medical equipment, but there's not a supply store in their area, how would this patient get the medical equipment that they need? So we would advocate for finding out, what resources are out there. Is it some in the neighboring town? Does a neighboring town health medical supply store, do they deliver? What does that look like? So, but we do want to make sure that there's equitable distribution of resources, and if it's not right there at the person's hands reach, where is it at? And then how do we make sure it's accessible? Now it's on them to, get the medical equipment or whatever, but we just want to make sure that they have all the information that they need about so that they can take care of themselves. So non-malfeasance is doing no harm. We want to avoid any actions that could cause harm to the patients. We want to make sure that beds in the lowest position, call lights that we reach. If it means the care plan says that there should be one person assistance, two-person assistance, we want to take the time to provide whatever it is for that client. We talked about moral distress. It occurs when the nurse knows the ethically correct action, but feels powerless to act due to institutional or legal constraints. What might happen if we report, this? And we did identify, sometimes we as a whistleblower, you might need a support system that includes a lawyer. We did identify that. So criminal law, we're not supposed to. So let's talk about medication administration rights. So making sure that we have the right patient, the right medication, the right time, and all of that. But what if the patient's out of this medication? Can we just borrow from the next patient? What if we're on the same medication? We're not going to get our prescription filled until tomorrow. We cannot borrow for ourselves or any other patients. That is considered as stealing medication. That is a criminal offense. Making sure when you're counting narcotics, they are to be accounted for at a minimum of every 8 hours. Some facilities might do a little bit more. So make sure if you're that second signature, make sure what you're signing is what actually matches up with the paperwork. For example, whether or not it's electronic or actual paper, if it says 5 Loratabs is remaining in the cabinet, you make sure that you see the paper that says 5 and what's in the drawer actually says 5, and then your signature on that. Don't be so quick to just sign off on things that you are not verifying, because when you sign off on it, if something comes up, then they're going to go back to what the paperwork says, whether or not it was an electronic signature or not. Okay, well, who were the 2 signatures? And then they go from there. Drug testing may be involved, searches may be involved. It might include that charges are brought up. So just make sure that we're not borrowing medications, even if it means patient to patient. Failing to follow standards of care and causing harm, that means negligence. The care plan says this person needs 2 persons assistance, and we didn't have time to wait on nurse whoever, so we just went on, and that patient had an injury, sustained an injury. So they're gonna look back at the care plan. What does this say? What's our roadmap of what's supposed to have happened with this patient? Well, because we didn't have the 2 people like it says, well, we are negligent. We are not following the standards of care, and we actually caused the harm. We are the reason why this person received harm. So we do want to keep private information private. Health information should be protected. So we want to make sure when we're disposing of anything with a patient's name or any identifying information on it, making sure that it cannot be identified. A lot of facilities have these markers or these devices that you can actually mark out stuff. You can't see even if you hold it up, you can't see what it is. They have certain receptacles for you to actually place certain things in. So just make sure that we are not sharing protected information that should not be shared. Even if it's a family member, be careful with that. And so just make sure that we have the patient's permission when we are sharing information. Make sure we have their consent, their permission, even if it's with family members. We are expected to maintain patient's confidentiality. It is crucial to maintain that confidentiality and protect that patient's privacy. If we are in a hospital setting, patients in the emergency room, we're taking care of them there, and that patient transfers to med-surg, we're no longer taking care of that patient. So therefore, we should not be looking in their record. We should not be discussing their information. That patient is gone on. Our care, we've been relieved of providing care for that patient. So we talked about the Nurse Practice Act. There are activities and tasks that a nurse can legally and we're permitted to perform. The legal scope of nursing practice, and that's there to protect the public as well, us and the public. Because if it ever comes up, well, the nurse should have done. Well, let's look at what the Nurse Practice Act says. Remember that facilities, policies, and procedures is going to mirror what the Nurse Practice Act is saying. They should not be asking us to do anything in a facility that's out of our scope of practice that we cannot lawfully actually complete. So I'm going to pause right here. You do. Our scope of practice are activities that or tasks that we can complete as a nurse legally. We are legally permitted to perform. It's in our scope of practice, and this protects the public. Can a nurse practice without a license? No, this violates the Nurse Practice Act, because remember, you're supposed to be licensed in whatever state that you decide to practice in. So even if you're asked to perform a task that is outside of your scope of practice, can you or should you perform that task? No. And unfortunately, sometimes people will ask you to perform a task. Not that it might not be ill intent, but sometimes it might be. But nevertheless, it's going to fall back on you. The answer is not going to be, well, I didn't know that I knew that wasn't in my scope of practice, but they asked me. No, this will violate. This is a violation. So make sure that you are only completing tasks, and speak up for yourself. If you're being asked to complete a task that is not in your scope of practice, no matter if an RN asks you or a physical therapist, a healthcare provider, you speak up and say, no, this violates my the Nurse State Practice Act. I am not lawfully I cannot lawfully complete that task. So just speak up for yourself. Informed consent is where a patient voluntarily agrees to treatment after an explanation has been given about whatever the task or the intervention. We did talk about who could complete a task, our incomplete submission assessments. LPNs can administer medications such as by mouth, intramuscular, sub-Q. The RN can do it as well. Both nurses can perform catheter care. They can perform wound care. The unlicensed personnel, remember, they cannot interpret numbers. For example, they can obtain the blood pressure. They can, a lot of facilities, they can also obtain glucoses. But the unlicensed personnel cannot interpret information. It is never okay for the doctor or the registered nurse to ask an unlicensed personnel to perform a task outside of their scope of practice. So, malpractice is a legal wrong involving harm caused by the nurse's failure to follow standards of care. A tort is a civil wrongdoing that causes harm, leading to legal liability. Negligence is failure to act as a reasonably prudent nurse would that results in patient injury. Defamation is making false statements that damages a person's reputation. We talked about this early on too, that we are mandated reporters. And so we're obligated to report suspicion, not whether we don't have to have all the facts and confirmation and all of that. But we are mandated reporters. If we suspect child abuse, elder abuse, even without confirmation, we must report that to the appropriate authorities, whether or not that's Child Protective Services, Adult Protective Services. They're all different authorities out there. And so we are mandated reporters. So what are some examples of suspected elder abuse or neglect? So just think about that. Poor care. Think about pressure ulcers, like, bruises. Is this an expected outcome based on this client's chronic disease processes that they have going on? Is it expected that they will have bruising? For example, if someone's taking a blood thinner, then they might have bruising. So that's why I was asking, is this an expected outcome of what's going on with this client? But they have bruises and there's no reason why that they might have those bruises, and there might be suspected elder abuse or child abuse. Domestic violence, we must document the disclosure and refer them to the appropriate authorities. Okay. Even if we have healthcare workers, people on the team, and they are impaired, we must still report that. We don't have to have a confirmation because we do want to protect the patient and others on the healthcare team. We do want to make sure the patient is safe and receive the appropriate care at all times. So that will include notifying the supervisor, the nurse manager, depends on what setting you're in. And of course, be expected to document, write down, whether not electronically or paper and pencil, what your observations are. Make sure that everything is factual. We will have to file a report according to the facility's policy in the state law. You might have to actually call the police and actually fill out a police report. So it just depends on what the facility policies are and that state law is. We do want to continue to monitor the patient and then follow up on the situation. Medication administration, we just talked about that. If there's an error in documenting, if there's an error as a result of medications being administered, we want to document that. Make sure that our reports and our information is thorough and that we're documenting the facts. We want to document according. Usually facilities have forms and procedures for that documentation. So sentinel events are unexpected events that result in or has the potential to result in serious patient harm or death, serious physical, psychological injury. And so a sentinel event a person may end up with permanent or temporary harm. And it's usually an investigation will be done in the event that something happens to a person. Root cause analysis, these are system failures that must be identified to prevent their reoccurrence. So they have a procedure where they have like timeout, we call it timeout. And it's as a result of wrong operations, wrong procedures being performed on the wrong person or the wrong body part. And so because there was some type of system failure, this person was not correctly identified, the extremity, the leg or the arm was not correctly identified, then we don't want that to happen to anyone. So we must put measures in place to try to identify what happened. How can we prevent this reoccurrence? We talked about confidentiality is a core ethical principle. We don't want to share patients' information without consent. It is a violation. We want to respect the patient's autonomy and their dignity. We as healthcare professionals, we are expected to maintain private health information private. So during the nursing process, we collect data, that's an assessment, planning, we provide input and help identify basic care needs. Implementation, that's the doing part. We carry out interventions, we implement interventions, we perform tasks. And then for evaluation, we want to report findings and to determine whether or not there has been any progress. Has there been any change or has this client condition gotten worse? Okay. Clinical judgment, each situation is unique and different. We do want to provide that individualized care. We do want to consider all components and issues that's going on with the client. We notice, for example, if we notice that there's a mental status change, there's a change in behaviors, look for those cues, those patterns that indicates that there's a change. For example, patient was oriented times 4. Now they're hard to arouse. They're oriented times 1. This person's blood pressure has hypertension. The blood pressure has been the highest systolically has been 140. Diastolically, it has been in the 70s. Now it's systolically 100. Diastolically in the 40s. Identify what that change is. This person wasn't coughing. Now they're coughing. Now the cough is productive. Uh, what is that change? We do want to consult with that and notify that healthcare provider. There might be several actions to address all what's going on with that client. We do want to consider ABCs. Is this life-threatening? Consider, is this an expected outcome or unexpected outcome? And we want to think about Maslow's hierarchy of needs. That helps us to decide what is priority. Algorithms assist with assuring standard-based approaches and evidence-based decisions. Okay. We talked about critical thinking already. And we talked about the RN and the LPN, the different tasks that they can have.